have like a bit of soft tissue down here connecting to your tib and fib, but there's the patella tendon. That patella tendon is another focus point. That helps us feel like fortified, balanced, and like strong as I stand. So as I'm working around that patella, I want to stop at the patella tendon, spend a bit of time opening that up, and that normally comes down about like my biceps tight, or like, oh, my quad or my hamstrings are tight. You're just going to like, it's good to have an idea of the anatomy like I was saying, but you're just going to look at the attachments and the insertments of like what direction the muscle belly goes. And you're going to work through it vertically face to face and vertically face to feet with a 45-degree angle windshield wiper pulling the fibers apart. But that's all it is. So it's like I don't want to go cross fiber too much. So I come along the fibers, play my 45-degree angle windshield wiper. We use the Wolfe non-surgical technique, and it just lovingly pulls those fibers apart in the muscle belly. The muscles are easy. So first step, beginning 4 to 5 inches above. On the quad, I'm going to work through the middle, medial, and lateral sides of this whole quad right here, playing my windshield wiper. And once again, it's like when we were doing the hip as well. You could come down the medial, come down the middle, come down the lateral, or you could kind of scan side to side, which I normally do because I just cover the whole general area as I'm working. So I'm going to work side to side as I work through the middle, medial, lateral, all the way down, focusing on that quadricep tendon, carving my way around the ledge. I don't want you trying to get the sides of the knee just yet. You could if you were like pivoting them quite a bit and it's all right on your body, but you're fairly important. Like my comfortability is the most important thing because then I'm doing the proper work. And right here is pretty easy for me because I'm resting my knees on the bolster. This is taking the weight off me, and then my buttocks just sits on my heels, and then my body weight is right over top of my elbow anyways. And it's like, you're not going to be in these positions for any longer than 6 minutes. And then you are going to flip over and do it again, the top portion, face to feet, sitting directly like so. And I'm just hanging out. You could take another bolster if you had a little bit larger buttocks, and then you would tuck it in right here so I could sit nice and flush. But like, I'm good. Like, I'm not having to balance. I'm just hanging out like this. And my body weight's going to be leaning into her anyways. So I'm just sitting here. Going to begin 5 to 6 inches above in the quad, but now I'm pulling everything up and in instead of down and out. And so I'm going to be playing my windshield wiper, working my way down. Once I get down to the knee, after I work through the middle, medial, and lateral, I'm going to focus on that quadricep tendon. Then I carve my way around the patella, staying really close to it. And then my another focus point in this position is working right below the knee at that patella tendon. Then I work my way back to my starting point. So that is the first main position that the client is in before I do any other side. We're good with that? So we did the top from both directions. I'm just turning around to talk to everybody, but I'm just going to stay face to feet, because then it saves me from flipping back and forth every time to go face to face. I've already began the treatment. Me and the client are comfortable. We were chatting while I was doing the top portion, so I'm just going to stay face to feet. And I would just go to the medial side of her leg, so I would have her rotated out. If they are so limited in their hips that they can't rotate it out, that's if I would remove the bolster and I would completely get her into fetal position. So when we are doing the sides of the knees, you're going to see that you can either use the bolster or your body can become the bolster. I'm going to show you on one side what it would look like with a bolster. I'll show you on the other side what it looks like with a body, vice versa. Okay.